Hello, are you ready to jump in and learn about research and evidence as a foundation for nursing? This PowerPoint is just to provide you with a general overview, and let's go ahead and dig in. Just to put your mind at ease about this course, please note that it's not about conducting research. Most nurses don't like to do research unless you are an academe, and maybe some of you do like research, but please note that it's about using research and other non-research evidence in practice. So the big broad goal of this course is that you can find, appraise, which means make a judgment about, and to use evidence in practice. Specifically, what this course is really wanting you to become very skilled at is that you have a question, you can go find evidence about it, that you can then find the evidence, you can read it, and you can understand it and determine whether it's good or not. And then you can determine, can I possibly use this evidence in my practice? And taking you all the way through, this course is also going to help you to really fine-tune your skills in conveying those results to stakeholders about potential practice changes. And overall, we really want you to become a champion in your practice setting, to really look at evidence-based practice and to really elevate the practice level at your particular setting. This PowerPoint is going to give you a great overview of really understanding the differences between research and evidence-based practice. Your discussion is going to really require you to build on that and to discuss those differences from your perspective. So these are the overlying objectives for this presentation. So let's see what's next. So let's look at how would we define nursing research. You can see from this slide that there's some key words that are really come to the forefront. Systematic, diligent. It's an inquiry. It's about to answer questions and solve problems. It's scientific, which means that there are very specific ways in which it's conducted. And again, it validates and refines existing knowledge, generates new knowledge, and it can be generating that new knowledge that can ultimately influence the care that we deliver and influence the outcomes that patients can achieve. Research has four main processes. This is the first one. The description is that it answers a question, what is it? So it's helping to generate knowledge and uncover information about certain concepts or phenomena. For example, the phenomena of postpartum depression. So it really is trying to look at a better understanding of something. The examples that you can see here, this is a lot of what I do my research around, is what is a transition of practice like for newly licensed RNs. And I'm also looking at a lot about the differences between urban and rural newly licensed RNs. So I do some descriptive research because I want to answer that phenomena about transition to practice for new nurses, and what's a phenomena of rural nurses as they enter practice. The second purpose is to explain. So it's really looking at trying to find answers about why things happen. So one of my areas of research is I want to find out, why do newly licensed nurses leave their practice? So I'm trying to explain that phenomena so that eventually we can put into place strategies to prevent them from leaving. But here's some other examples of questions that get at explanation and that could drive a research project. So the third purpose of research is to predict. And what that does, it really gives us information about that something will happen and this outcome will occur as a result of that. So I look a lot at what keeps newly licensed nurses in the organization. So I have found in my research that if newly licensed nurses are not satisfied with their orientation or their onboarding processes, that they're not going to be as committed to the organization. So that gives me a lot of information to know that if my new nurses are not satisfied, that they can leave. So that's how this research can predict something that happens. It's their eventual leaving the organization. So the last purpose is control. And this is really what we want to do, is we want to control or strive towards certain outcomes. So again, in my work, one of the things I do is I want to prevent turnover. So that's my outcome. So I'm trying to implement strategies to prevent that turnover so I can control that outcome of nurses turning over. So I've been doing a lot of research around nurse residency programs for newly licensed nurses, and does it indeed control or prevent their turnover? So this type of research is really what we strive for, because if we can find good research that can, or we produce good research and we read good research that can control outcomes, these are the things that we want to do to implement in as part of our evidence-based practice. There are two broad methods of research, quantitative and qualitative. These are each broken down into more discrete methodologies under these two big types. Quantitative is counting, measuring, numbers. When you read the reports of quantitative research, you're going to see them filled with statistics. Qualitative reports and research, on the other hand, are about observation of phenomena conducted through interviews with individuals, and your research findings are in the form of words or in a narrative. So we'll be talking about a lot of these as we move on through the course. Now that you have an understanding about the research and research process, let's contrast this with evidence-based practice. Evidence-based practice is the integration of research evidence, but you combine that with your own clinical expertise, your experiences, and your knowledge, and you take into account what the patient wants, the patient's values and their thoughts about their health care, and putting that within the context of delivery of health care that is quality and cost-effective. So this model really depicts what we just talked about, and the ultimate goal of evidence-based practice is in the center, is that improved patient outcomes. This diagram that's found also in your Melnick textbook, it basically incorporates what we just talked about, but it puts it in the larger context of the organizational culture. And it is just a little bit more comprehensive than the last model, but again, it includes the same components. But again, evidence-based practice occurs within the context of your own individual organization. So we've been talking a lot about best evidence. Well, what is best evidence? How do you figure out what type of evidence is better than another? So all evidence is not created equally. You can see a picture here of a pyramid, and at the top of the pyramid would course be the gold standard of evidence. At the bottom would be the least best evidence. So evidence is arranged in a hierarchy. So these next slides are really going to walk you through this hierarchy, because it's going to be essential for you to understand this so that you can select the best evidence to answer your questions. There are two broad categories of evidence, external and internal. External is what you read in the literature that's generated from very specific types of research, randomized controlled trials, descriptive studies, and those are things and types of studies and findings that are meant to be applicable and applied in various settings. And then there is internal evidence, evidence that you might have generated in your own practice setting that was part of a quality improvement. For example, you may have just instituted barcode drug administration, and you did your own quality improvement study to determine whether or not that did indeed in your organization reduce medication errors. So these are the two types of evidence. So when we look more specifically at those two types of evidence, we can again arrange them in a hierarchy. And this hierarchy is one example of how they can be stacked against each other. You may see differences in different publications, but this is just one way of looking at levels of evidence. So up at the top are systematic reviews, followed by randomized controlled trials, cohort studies, case control, case series, and editorials. So you can see way at the top is the most rigorous, the most comprehensive type of research evidence, and I'll describe that in just a minute. And then it's followed by randomized controlled trials. So let's look a minute at systematic reviews and have an understanding about why they're at the top of the evidence chain. The reason why this summary, systematic reviews, because it's a summary. It doesn't just look at one study. It looks at a number of studies and it amasses evidence across those studies. So you can imagine if you had one study that said this intervention worked and you had a group of studies that said it didn't, well, which one are you going to believe? The study, the synthesis or the systematic review of lots of studies that give you a better assessment of whether or not this intervention did indeed work. So synthesis of research studies is the gold standard for patient care. Our clinical practice guidelines are based on systematic reviews, and that's an important part because it's really pulling together evidence from many sources to get the best evidence to drive our practice. Based on that, the strongest evidence is again a systematic review where it follows a systematic process of bringing together various research reports and, if possible, doing a meta-analysis, which is basically doing a statistical process where results from studies can be grouped together to really generate a statistic that gives us some idea about how strong the effects are of a particular intervention. The weakest evidence, of course, is if your colleague says that this works, or someone just says, from my experience, this works. And it's important, again, to distinguish that. Again, your best research is that systematic processes that is pooling results across studies. So this is the evidence food chain. It shows you, again, this hierarchy that those reviews and systematic reviews, meta-analyses, meta-synthesis are kind of at the top of the food chain, and then it goes down to the case reports and anecdotal. So it's one trumps the other as far as its level of evidence and the confidence that we have in the findings. So if you don't believe me that evidence-based practice is important, the American Nurses Association has identified this as a standard of professional nursing practice. And you can see here that this is an expectation of every single nurse, that we utilize current evidence-based nursing knowledge, including research findings, to guide our practice. And as you become a master's degree nurse, it's essential that this is part of your practice. This is part of our overarching graduate student objectives, and this is what is expected of MSN nurses in our nation. And these are more reasons why evidence-based practice is vital to nursing. It is really helping to solve those problems in practice that has even been found to be linked to greater job satisfaction. That studies have shown that nurses who are basing their practice on evidence are happier in their jobs. And we know that nurses who are happier in their jobs are more likely to stay in those positions. But those of you that have gone through JCAHO, you know that evidence-based practice is something that they really look at to see if it is indeed being implemented in your practice setting. And of course, for reimbursement purposes, this is critical. And wait, we have more reasons. You can see again, it's that improved outcomes for patients. It's for providing those practice guidelines that we use in our practice every day. Again, looking at the ANCC and magnet status, these are all excellent, excellent reasons that we have to implement evidence-based practice every day. For those in the ICU, I'm sure you're very familiar with this evidence-based practice success story. It's about the development of ventilator-associated pneumonia. Those of you working in the ICU, you know that it can incorporate a significant number of infections that patients can become subjected to in the ICU. But look at this, it can increase mortality, length of stay, and healthcare costs. And this is something I'm sure all of you are aware of, that we needed to really look at strategies to decrease this occurrence. So part of your evidence-based practice are these things called bundles, which I know you're probably familiar with. And this is a set of interventions, when bundled together, are intended to prevent certain outcomes. So this is just an example of the elements in the bundles. But where do you think this came from? So the recommendation about elevation of the head, one of the bundle items, is it came from this research in 1999. And they did this RCT with 86 patients that were being ventilated, and they found that it, just by simply elevating the head of the bed, that we could decrease pneumonia. So this is an example how a piece of evidence got bundled into a care practice in order to improve the outcomes for patients who are mechanically ventilated. So this is an example of evidence-based practice being put into practice. So by now you are pretty familiar with why we do evidence-based practice. So let's look at how do we do it. So these are the key steps that are identified, and these are outlined by Melnick and throughout your text. So let's break these down a little bit, because actually we're going to kind of be going through many of these steps of the EBP process, and this will give you a good grounding as we move forward in the semester. So EBP starts first with a burning desire, is that you have this need to get a question answered. But again, to have that spirit of inquiry, it has to be within an environment where you can be surrounded and supported by others. So you start with that wanting to know the answers, and then you look for individuals who can support you in that process. And this semester it's going to be each one of us supporting each other to identify evidence-based practice answers to a question that we have raised. So the next step is that it's driven by a clinical question. And so you have that spirit of inquiry, saying, oh, I wonder about this. And then you frame it within a specific question. The specific question is critical because this frames everything moving forward. It identifies which patient population you're going to focus in, what particular intervention are you most interested in. And you don't necessarily have to do a comparison intervention, but you have to have an outcome. And an outcome is what you want to have happen as a result of that intervention, or you're interested in finding out what will happen as an outcome of that intervention. So this PICOT question is going to be driving the rest of your work this semester. It's going to be driving your practice paper, your integrative review, and a lot of the discussion that we're going to be having. So be very clear as we move forward about what your particular PICOT question is, and we'll be talking about that as we move forward. Okay, so you're excited, you've got the spirit of inquiry, you've got your question, now you have to go out and get to work. And how you go out and get to work is you have to find the most relevant, best evidence, the ones that are at the top of the hierarchy, in order to answer your question. So here again is a listing of the various levels of evidence, and your goal is to find the best evidence. Now please note that not every question are you going to find systematic reviews or meta-analysis of RCTs. And don't be disappointed if you can't. There just isn't a lot of RCTs and systematic reviews of specifically phenomena that nurses deal with. So just know that it's not your issue, it's just the lack of studies of a high level one. Okay, you've got your question now, you've got some of the literature, some of the research studies. Now this is where the hard part is. You have to critically appraise the evidence, which means that you have to critically evaluate it, determine, is this any good? Is this something that I would want to base my care practices on? So two questions. Are the results valid? Does that mean, is there truth to those results? And the only way you're going to be able to determine that is if you dissect the methodology and you read the research study carefully, determine whether or not the conclusions that were reached were indeed valid. Second, are they reliable? And that means, did the interventions work? And can they be generalized? So even though the study found positive results, can I use it in my practice? Maybe it was a study with pediatric patients and I work with adults. And so can I use those findings from a pediatric study to my adult population? So that's an important part in step 3. So continuing on with some other elements of the appraisal process, again, is that will the results help me in caring for my patients? That's what I just talked about. That's the applicability. It's also called generalizability or external validity. And you have to determine about whether these results can be applied to your particular patient population. And it might be a great intervention, but maybe we can't fund it. We don't have enough money to do that type of intervention. So those are all things that you have to determine as you critically appraise the evidence related to your particular question. So as a summary of your appraisal process is that you have to look at your level of the evidence. Again, where does it fall? Is it at the top of that pyramid or is it the bottom? Then you have to determine the quality. Was it valid results based on good methodology? Was it reliable and that you could trust the intervention, that it worked? And was it able to be applied to your particular setting and your population? And then you can make a determination. Yeah, I feel pretty good about this. And I think that this is something that we want to implement in practice. But you cannot go to the last step of confidence without going through those other two, about identifying the level of evidence and specifically about determining the quality of the evidence. So don't skip that critical central aspect of appraisal. Okay, step 4. So you found good evidence, you found that it was of good quality, and now you have to figure out, okay, I think that we can apply this in this setting, but then you have to really put into perspective about whether or not that we have that expertise to implement that intervention, and whether or not the patient or the family have an interest in that. For example, if we want to look at using yoga to decrease depression, maybe somebody doesn't want to do yoga, even though it can be very effective in decreasing depression. Maybe the family or the individual just doesn't have any interest in that. So you have to take that best evidence and put it within the unique perspective of each patient. Okay, you're not done yet. So you've got your evidence, you've got your practice change, you implement the practice change, but you're not done yet. What you have to do is evaluate whether indeed it worked. It might have worked in the research study that you analyzed, but it may not have worked for your patients. So this is a very cyclical process of finding the evidence and making certain indeed did we achieve the outcomes that we had intended. Okay, so now you've found your evidence, you implemented it, you evaluated your own outcomes. You've got step 6 here, and this is the important piece of sharing it with others. And this is why it's important to disseminate what happened when you did this. So you need to share it with your nurse manager, other individuals, your QI, person in charge of QI in your organization. It's important to do that so that you can document the outcomes of this evidence-based practice change. And it's also a good idea if it's that you can present this at some of your professional conferences, because we need to share the evidence with our colleagues. Well, evidence-based practice sounds like a win-win, doesn't it? Well, if you really look at evidence-based practice, it's not implemented as fully as we would like. And these are some of the reasons. The biggest one is that we don't have the knowledge and the skills to do that. And that's why this course is so critical in helping you to do that, this process, because you are going to be the champion in your organization and you have to bring others on board. So we really want to be working with you through this program to help you to be that champion and to bring others along in this process. So here are some more barriers, and you have to think about these in your own organization. Is if you go through this process this semester and you've got a really good idea to implement a practice change, what are you going to have to think about in order to fully implement this back in your organization? So be attuned to these and think about them as you move forward, because as a culmination of effort this semester is you're going to be writing a paper, and the paper is going to be asking you to identify what are some barriers to potentially implementing your recommendations. So pay attention to this and start doing kind of an internal look at you within your organization about what some of these barriers might be if you find some excellent evidence to change something very specific in your practice and your setting. A few other barriers here, and this is what my job is. My job is to really help you to be able to accomplish these elements, to be able to really peel back the layers on various types of evidence and to really understand that. So there's lots of videos, there's lots of materials that I can provide for you, and I'll be doing some role modeling about how you can dissect articles all the way through in the semester. So I feel confident at the end of the semester that you're going to be able to do these things so you can adequately feel good about what you might bring forward as practice changes. A few more barriers listed here. I just want to talk about the last barrier is lack of support from the healthcare agencies and administrators. From the very beginning, I would let your nurse manager know or your supervisor that you're going to be engaging in these processes, and bring that individual into this process with maybe helping you to identify your PICOT question or a practice problem, maybe working with your QI, because that's going to really help you to implement change if indeed you found enough evidence to warrant that change. So get your people at home that you work with to be behind you in this question, and you'll have more opportunities to be successful if they are on board. Well, you've got some work cut out for you, but what you need to start doing right now is to start thinking about that question. What's puzzling in your practice? It's something that you're doing that you think needs to be changing. The sooner you identify this question, the better off you're going to be. So keep thinking about this question, come up with some ideas, we'll brainstorm about them, and your next module will give you a little bit more background about how you formulate that question. This concludes the Intro to Evidence-Based Practice. And for the next module, make certain that you read the articles that are identified as your assignments, view the videos because they're very helpful, and again start thinking about the question that you want to explore over the course of the semester. Excellent videos, your text is very good, so do your readings because that's really going to help you to move forward. Please notify me if you have any additional questions, and just keep me in the loop with how you're doing. Bye-bye.